Pap smear results. What does the medical terminology mean? Imagine going for a routine checkup and getting your pap smear results back. You might see some unfamiliar words and wonder what they really mean. Let's break down the common medical terms used in pap smear reports so you can understand your results clearly. A pap smear is a screening test that looks for abnormal cells in the cervix, which could be early signs of cervical cancer or precancerous changes. The results are categorized to help your doctor decide what steps to take next. If your report says negative for intraepithelial lesion or malignancy, that means no abnormal or precancerous cells were found. Your cervix looks healthy, and there's no sign of cancer. Sometimes, the report might mention minor issues like inflammation or infections such as yeast or herpes, but these are not related to cancer risk. Regular screening should continue as scheduled. If the sample is unsatisfactory, it means not enough cells were collected, or the sample was obscured by blood or mucus. In that case, your doctor will likely suggest repeating the test in situ for months to get a clearer picture. When results show abnormal cells, it indicates changes in the cervical tissue that could be due to infections, inflammation, or early signs of precancer. These do not mean cancer is present but requiring further assessment. The Bethesda system is commonly used to classify these findings. For example, if your report says atypical squamous cells of undetermined significance, or ASCUS, it means there are mild changes in the flat cells covering the cervix. Often, this is linked to human papillomavirus infection or inflammation. Your doctor might recommend repeat testing or HPV testing. If HPV is positive, a more detailed exam called colposcopy might be needed to look closely at your cervix. Low-grade squamous intraepithelial lesion, or LSIL, suggests mild abnormalities often caused by active HPV infection. These changes may go away on their own, but your doctor will probably suggest a colposcopy to check for more serious issues. If the results say atypical squamous cells that cannot exclude high-grade lesions, called ASCH, it's a sign that the abnormality might be more serious. Colposcopy is usually recommended to investigate further. High-grade squamous intraepithelial lesion, or HSIL, indicates more severe abnormalities that are likely precancerous. Prompt colposcopy and biopsy are essential to determine the exact nature of these changes. Sometimes, the report might mention atypical glandular cells, or AGC. These are changes in the glandular cells that line the cervical canal and uterus. They can be associated with precancer or cancer inside the cervix or uterus, so your doctor will likely recommend additional tests such as colposcopy and possibly an endometrial biopsy. Very rarely, pap smears detect cancer cells from invasive cervical cancer or other malignancies. If that happens, immediate further testing and treatment are necessary. Understanding your pap smear results helps you know what's happening in your body and what actions might be needed. A normal result means no current signs of cervical cancer or precancer, but regular screening remains important because cervical changes develop slowly over time. An abnormal result doesn't mean you have cancer but indicates the need for closer monitoring, additional testing, or treatment to prevent progression. Human papillomavirus infection often accompanies abnormal results and influences follow-up plans. Always remember, your healthcare provider is the best person to interpret your results and guide you through the next steps. Regular screening and early detection are key to preventing cervical cancer and maintaining reproductive health. If you have questions or concerns about your pap smear results, don't hesitate to reach out to your doctor for personalized advice.